You reach into your medicine cabinet this morning, like you have every morning for the past year or two. Your hand moves automatically to the same bottles in the same order. Benadryl for sleep, the bladder medication, the antidepressant, the pain pill. You swallow them with your coffee without thinking about it anymore. It is just routine. It is just your health, being responsible. But here is what I need you to know right now. That routine you perform every single morning may be doing something to your memory that nobody has ever connected out loud for you before. It is not obvious. It is not immediate, but it is measurable. And it is reversible if you have this conversation with your doctor today instead of a year from now. Today, I am walking you through 5 medications sitting in medicine cabinets across this country right now. Medications prescribed for legitimate reasons, and showing you exactly what the research says about what they are quietly doing to your brain while you take them exactly as directed. If this matters to you, if you want to understand what is actually happening inside your own medicine cabinet, subscribe to The Healthy Habit and turn on notifications. Most people your age will scroll past a video like this without a second thought. You are choosing something different. You are choosing to know. I'm Dr. Gerald Mark, and I have consistently watched patients in my clinic describe the exact moment they realized the forgetfulness they thought was aging was actually a direct response to a medication they had been taking for years. After age 60, your brain is undergoing real biological changes. The chemical messengers your brain depends on are becoming less abundant. But here is what almost nobody understands. Certain medications prescribed for completely legitimate reasons can accelerate these changes in ways that feel indistinguishable from dementia itself. One of my patients, David, was a retired engineer who had managed his health carefully for decades. He took his medications exactly as prescribed. He felt proud of staying on top of things. And then something subtle began to shift. Does that sound familiar to you? To understand why certain medications affect memory so powerfully, you need to understand one chemical your brain depends on. Absolutely. It is called acetylcholine. Think of acetylcholine as the delivery system for memory formation. When you learn something new, when you meet someone, when you read something worth remembering, acetylcholine carries that information from one brain cell to another and locks it into place. Now imagine a medication that blocks those deliveries. That intercepts the message before it gets locked in. The information arrives at your brain. You think you are paying attention, but the message never actually gets stored. You feel sharp, you feel fine, but your brain is silently struggling to do the one thing it has always done automatically. And the older your brain is, the fewer backups it has to work around that blockade. That is why you feel it. That is why it seems to happen faster than it should. This is not theoretical. This is happening in millions of medicine cabinets right now. David was 68 years old. He had a routine. Morning walk, coffee, his medications in order. He took them without thinking anymore. Just part of the morning ritual, like brushing his teeth. For years this had worked fine. But in his 3rd year of his current medication routine, something shifted. He started forgetting where he parked the car. Multiple times a week. He would read the same paragraph twice and realize he had not retained a single word. His daughter noticed it first. She came to visit, and he told her the same story 3 times in a single afternoon. David knew something was wrong. He knew himself. He knew this was different. He brought all his medications to a specialist, not his regular doctor, but someone who takes time to look at the whole picture. And that is when someone finally connected the dots. One of his medications, something he had been taking for years, was blocking acetylcholine so aggressively that his brain had been quietly losing its ability to form new memories. The damage had already happened. But the moment he learned the cause, everything changed. Because now he understood. Now he had options. Number 5 is diphenhydramine. You know it as Benadryl. It is the little pink pill people reach for to fall asleep or calm an allergy. Most people assume that because nobody needs a prescription for it, it must be gentle. Inside your brain, it is doing something very different. Benadryl belongs to a family of drugs called Anticholinergics. They block acetylcholine, that exact memory chemical we just talked about. A 2023 paper published in the Journal of Geriatric Cognitive Disorders found a 54% higher risk of developing dementia in older adults using anticholinergic drugs regularly. More than half, again, the normal risk from something most people treat like candy, and that is the pill sitting on your nightstand right now. The one you do not think of as medicine because you bought it at the drugstore. You swallow it without reading the label, without questioning it, and every single night you are making a choice you did not even know you were making. There is a safer option. Your doctor can offer loratadine, sold as Claritin, which does not cross into the brain tissue the same way and carries far less cognitive risk for long-term use. Number 4 is the proton pump inhibitors. Omeprazole, sold as Prilosec, and esomeprazole, sold as Nexium. These shut down acid production in the stomach for heartburn and reflux. People stay on them for decades because the moment they stop, symptoms return. But your stomach needs acid to pull certain nutrients out of your food. Chief among them is vitamin B12, which protects the wiring of your brain. Turn the acid down far enough, long enough, and your B12 quietly drops. In 2016, a large study in JAMA Neurology examined more than 73,000 people aged 75 and older. Regular PPI users had a 44% higher risk of dementia than people who did not take them. That is the pill you swallow every morning, believing you are solving a problem. And that belief is exactly what makes this so hard to see. You feel better. Your heartburn is gone. And nobody ever tells you that relief is coming at a cost to your memory that you will not fully understand until you cannot remember what someone just told you 5 minutes ago. There is a safer alternative. Your doctor can discuss switching to an H2 blocker, like famotidine, sold as Pepcid, which is far less likely to affect your brain or deplete critical nutrients. Number 3 is oxybutynin, sold as Ditropin. It is given to seniors who deal with sudden urgency, that overwhelming need to get to the bathroom that can reshape an entire day. The relief is real. The embarrassment it spares people is genuinely important. But oxybutynin works by blocking acetylcholine, that same memory chemical, and this one slips across into the brain very easily. In 2019, the British Medical Journal published a study of people over 65 who took oxybutynin for more than a year. Their risk of dementia was 49% higher, close to 1 in 2. And here is where David's story first began to reveal itself. His daughter mentioned that his memory issues started about 2 years after he began taking a bladder medication. She did not make the connection at first. Neither did David, but someone had to ask the question, when did this actually start? And that is the moment everything changed for him. That is the moment someone finally asked if the solution to one problem had become the cause of another. There is a safer option available. Your doctor can prescribe mirabegron, sold as Mirabetrix, which works through a completely different pathway and does not block acetylcholine at all while providing the same bladder control. Number 2 is amitriptyline, sold as Elavil. It is an older antidepressant prescribed for nerve pain, sleep difficulties, and migraine prevention. It is one of the most powerful anticholinergic drugs still in common use. It blocks acetylcholine so aggressively that memory problems stop being a rare side effect and become an expected outcome. In 2015, a large study published in JAMA Internal Medicine followed more than 3,400 adults aged 65 and older. Those with the highest exposure to anticholinergic drugs like amitriptyline had a 54% greater risk of developing dementia over 10 years. That is the pill David was taking. Not for depression, but for chronic nerve pain. His doctor prescribed it. It helped his pain genuinely and completely. And for 2 years, while his pain improved, his memory was being quietly erased. And nobody, not David, not his doctor, not anyone, was sitting in a room asking the most important question: what else is this medication doing to him? There is a safer alternative. Your doctor can consider duloxetine or gabapentin for nerve pain, which provides similar relief without the same devastating anticholinergic burden on your brain. I want to pause here and ask you something direct. Think back to when your memory first started feeling different. Can you connect that to when you started a new medication? Drop the year in the comments, just the year, and tell me what you noticed changing. I read every single comment you leave. Your answer might be exactly what someone else is searching for. Number 1 is anticholinergic polypharmacy. This is the danger almost nobody talks about. It may be the leading cause of medication-induced memory loss in older adults, and it may be happening in your own medicine cabinet right now. You were probably expecting one final single villain, one worst pill. The reality is more subtle and more dangerous. The greatest danger comes from multiple anticholinergic medications taken together, while nobody sits down and calculates the total burden on the brain. Polypharmacy simply means taking many medications simultaneously. Anticholinergic burden refers to the combined effect of all of those medications blocking the same memory chemical at the same time. Imagine David's exact situation. He was taking Benadryl every night for sleep, oxybutynin every day for bladder control, amitriptyline for nerve pain. Individually, each medication produced only a small effect. Together, however, those effects compounded rapidly. In 2022, a study published in Age and Aging tracked more than 280,000 older adults and found that those with the highest anticholinergic burden had a 120% higher risk of dementia within 10 years. More than double the risk. And the overwhelming majority had no idea they were taking anticholinergic medications at all. This is what was happening inside David's brain every single morning when he reached into that medicine cabinet and swallowed 3 pills, thinking he was taking care of himself. This is the exact moment when you walk past your own bathroom mirror and you do not quite recognize the person looking back at you. Not because of your face, but because something inside feels quieter than it should. That is what anticholinergic polypharmacy feels like from the inside. Working with patients on exactly this issue, I put together something I call the Medication Burden Review. I created this because I kept watching the same pattern repeat. Someone would come in concerned about their memory. We would review their medications together, and suddenly everything made sense. Their brain was not failing. Their medication load was. I want to give this framework to you right now because I believe it is the clearest and most practical way to take everything we just covered and turn it into a real conversation with your doctor this week. The review has 3 simple steps. First, gather every medication you are taking. Prescription, over-the-counter, supplements, everything, and write down when you started each one. Do not rely on memory. Write it down. Second, note the specific cognitive changes you have noticed and when those changes started. Can you connect the memory loss to starting a particular medication? Third, bring both lists to your doctor or pharmacist and ask them directly, which of my medications block acetylcholine and what is my total anticholinergic burden? That single conversation can change everything. Here is what I want you to do before your next doctor's appointment. Tonight, gather every medication bottle you have. Write down the name of each medication and the date you started it. Do not trust your memory on this. Think back to when you first noticed cognitive changes. When did the forgetfulness start? Can you connect that timing to starting any particular medication? Ask your doctor this exact question at your next appointment. Based on my medications, what is my total anticholinergic burden, and are there safer alternatives available? Write down their answer. David did not stop all his medications, but he did sit down with his doctor and asked for that medication burden review. He switched one medication to a safer alternative. He reduced the dose on another. Within 3 months, the fog began to lift. His first real sign was one Tuesday morning when he walked into the kitchen and realized he actually remembered why he came there. That seemed small, but it was not. Within 6 months, he felt like himself again. His daughter noticed it first. He stopped repeating the same story in one afternoon. He was present with his grandchildren again in ways he had not been for 2 years. He realized that what he thought was the beginning of dementia was actually a medication side effect that could be managed and even reversed. What happened for David is not a medical miracle. It is what becomes possible when someone finally asks the right question. You came into this video with a quiet worry about your own mind or about someone you love. You are leaving with something completely different. You are leaving with the exact knowledge that tomorrow morning, when you reach into your medicine cabinet, you can do something you have never done before. You can ask yourself, which of these are blocking acetylcholine? You can write down the date each medication started. You can connect the timeline of your memory loss to the timeline of your medications. And you can bring that conversation to your doctor. That is genuine power. That is what changes everything. Share this video with someone in your life who is taking one of these medications. Not to scare them, to give them the same power you now have. The power to have an informed conversation with their doctor about their brain health. Please subscribe to The Healthy Habit and turn on notifications. Here is my final question for you. Which one of these 5 medications are you currently taking, and have you noticed brain fog or increasing forgetfulness since you started it? Drop your answer in the comments. Small habits, done consistently, are the most powerful medicine your body will ever receive. I'm Dr. Gerald Mark. Build one healthy habit today, and I'll see you in the next one. Everything I have shared today is for general informational purposes only, based on published research and clinical observation. It is not a personal diagnosis, and it is not a substitute for care from your own doctor. Please consult your physician or a qualified healthcare provider before making any changes to your medications, diet, supplements, or health routine.